Assalamu alaikum. Hello everyone. I am Dr. R.C. Biloria, working as a consultant microbiologist and chief infection control officer for Lotus Hospital and Pratima Hospital. Today I am here for answering a few of the common queries put across. That is, how to take care of a COVID positive patient when he is at home. Before answering this question, I would like to put a fact in front of you. Coronavirus is a simple, delicate and fragile virus which can be killed by any disinfectant or even soap and water. Doesn't that relieve you so much? Coming back to the taking care of patient, we have to start with assigning a dedicated single well-ventilated room for the patient, preferably which have an attached bath with it. We have to tell a family member to take care of him, who the same member has to take care of the patient for the complete quarantine period of 14 days. It has not to be changed in between. The patient has to be given the items for the dedicated use of the patient alone, which doesn't have to be shared by the other family members, like the patient's personal items like the iPad, phones and laptops, utensils, bed linen, towel, hand rubs, water bottles. All of these have to be even washed separately with soap and water or any common disinfectant like 0.5% hypochlorite or phenol disinfectant. Patient has to be encouraged to put on the mask all the time and change it every 6 hourly. He should not touch the front of the mask, his eyes, nose or mouth anytime, because these are considered to be the dangerous areas for the transmission of the virus. He has to take care of the cough etiquettes and do the hand wash regularly and frequently with soap or water. If it is not available, he can use a hand rub. He has to take good amount of bed rest and have a well-balanced diet and keep himself hydrated. The caregiver who is entering into the patient's room even has to put on a surgical mask and gloves. After he is done with taking care of the patient, before moving out of the room, he has to dispose the gloves and the mask in a dustbin, and he has to do a hand wash and move out. The surroundings of the patient have to be cleaned frequently and regularly with a disinfectant, which I have already told, like 0.5% hypochlorite or phenol disinfectant, with concentrating particularly on the high touch points like the bedside table, bed rails, patient's appliances, the faucet of the water tap he has used, etc. The patient has to take care not to move out of his home for the complete quarantine period of 14 days until his 2 tests come out to be negative, which have been done 24 hours apart. This is all about taking care of the COVID positive patient and the caregiver. What about the other family members in the house? The other family members also have to restrict their movement to the patient's room. They, especially the high risk group like the elderly people, the people who have the secondary disease like the hypertension and diabetes, pregnant women or the children who are below 10 years of age. Every member of the family has to take care of good infection control practices like the hand wash, social distancing and cough etiquettes. They also have to monitor their health for the symptoms which can develop like fever, shortness of breath, cough, nausea, vomiting, anything related to the COVID symptoms. If so, they have to consult a doctor immediately in the nearest healthcare facility. This is all about taking care of a COVID patient at home to fight back against the COVID. Thank you. The second query which has been put forward is, what do we need to do when we have a COVID positive patient in our neighborhood? First of all, we don't need to panic. If you have come across a person who turns out to be a COVID positive later, you just have to observe your symptoms for first 5 days for fever, cough, shortness of breath. Continue monitoring your symptoms for the next 10 days more, completing it to the 14 days. If you are free of any of the symptoms for 14 days, consider yourself as safe. Now, if you have a patient who is COVID positive present in your neighborhood, it depends upon how is your locality, whether it's an apartment or it's a colony. If it is a colony, you don't need to bother about, because the distance of the houses in between is quite effective to doesn't allow the transmission of the virus. If it is an apartment, you have to ensure certain points. What are they? Number one, you have to ensure that the family as well as the patient are quarantined in their respective flats. They are not coming out of their flat at all. Second thing, you have to stop using the crowded elevators and better to take a staircase rather than an elevator. Third thing, you have to concentrate more on the disinfection of the high touch points of the apartment, like the elevator buttons, the side rails of your staircases, or the grills of your elevator, or any other point which has been frequently touched with a common disinfectant, maybe a 0.5% hypochlorite or any phenol disinfectant. Then at last, you need to give support to the family. Remember, you are fighting against the coronavirus, not against the patient or the family. If we give correct support to them, they may not come out of the house for their daily needs. You can buy groceries for them, essential items for them, and put them at their doorstep. Have a social distance of more than 6 feet and you are safe. They can take away the groceries and essential items inside without harming you anyway. So these are all the things we need to take care about our neighborhood COVID positive patient. Hope the answer to the query. Thank you.